health care. Can we do that? All right. 1, 2, 3. Protect by health care. Thank you. It is my honor to introduce somebody who has been fighting for health care his entire career, somebody who had this job as state party chair a long time ago, the congressman from this area, Congressman Sandy Levin. Thank you.
Well, thank you. I took my coat off because we're in a fighting mood, right? And we've just begun to fight again. You know, what this huge crowd says is we're now turning our anguish about November 8th into action today, tomorrow, and every day these next years, aren't we? All right. You know, Speaker Ryan said that I know, but listen to what he said. I quote, "I'll stay in complete sync with the president-elect." And what they're trying to do is to sink health care reform, and we are not going to let them do that, right? We're not going to let them do that. Talking about Speaker Ryan, he was at a town hall meeting a few weeks ago, and he called on a small businessman. And the businessman, I'm looking at what he said to the speaker, "I'm a Republican like you." But then what he went on to say, and the speaker's grin disappeared. He went on to say, "I was diagnosed with curable cancer. I am standing here today alive because of health care reform under President Obama." And then he added to the speaker, I quote, "Why would you repeal the Affordable Care Act without a replacement?" So I want to briefly, I was going to go to a number of constituents. By the way, we're here from all over. Earlier, I met somebody here from Bath, Michigan. From Chicago? We in Michigan welcome you from Chicago. All right, I'm going to just read one of the 4 statements that I had here. Here it is. My mom, listen to this. My mom was diagnosed with cancer in 2010. She did not have health insurance and had no hope of getting it without the ACA. In 2011, the ACA allowed my mom to get insurance to cover her extensive chemotherapy and radiation. I have no doubt that because of the ACA, she is alive today. That is our message here to the president-elect and to the Republicans in the House and the Senate. Keep us alive. Give us health care. Keep us alive. Keep our health care. I'm now going to introduce somebody who has known this struggle firsthand, also from Macomb County, Joyce Lalonde. Let's give her a warm welcome, and let's listen to her story. Joyce?
I stand before you, a 13-year breast survivor. In December of 2002, I received a call at my place of work that I was diagnosed with breast cancer. I had health care. One thing I did not have to worry about was whether or not I was going to have to find a doctor that they would approve, or that I had to make a choice between the nausea medicine for chemotherapy or chemotherapy itself. I stand with every other person who now has and have had a cancer of any sort or any time. We cannot be without health care. We do not have to make those choices. Health care is a right. We need to stand with every person around you, every person in your community, every person in your family. And we need to stand strong and we need to stand loud. We are not going to take this. We are going to fight it all the way. And helping us fight is one of the greatest fighters the working men and women of Macomb and the state of Michigan has ever had. Our very own Senator, Gary Peters.
Well, thank you, Joyce, and hello, everybody! Are we ready to stand united? And can we say in one loud voice that we are here to save our health care? Save our health care! Save our health care! Well, we will need to be united. We will need to stand strong in the days and months ahead as Republicans attempt to repeal this law that has helped so many people. Joyce's compelling story is just one of so many voices. You're going to hear more today. You will hear more from me as well later. But I have the distinct privilege of introducing a man who is at the very forefront of this fight. A man who has been fighting his entire career, his entire life for working men and women across this country. A man who wants to make sure that we all stand united, bringing everybody together. As you know, first and foremost in this battle, there are many battles, but we have a big battle in the United States Senate. And I will say that we are blessed to have a leader who can bring everyone together and focus our attention on this issue that touches millions and millions of lives all across this country. And I am so pleased that he came here to be with us because he knows that ground zero in this fight is Michigan. This will be ground zero, and all of you are those soldiers. So we need to be loud, we need to be enthusiastic when we welcome the good senator and the leader of the Democrats in the United States Senate, Chuck Schumer!
Well, thank you, Gary Peters, one of the great fighters for working families in America. And I want to thank you all. It's great to be here in Michigan. It's great to be here at Macomb Community College. It's great to see thousands and thousands of people here on our side on a cold winter January afternoon. Now, I know you could be in other places, maybe at church, maybe with the family, maybe getting ready to watch football, although Detroit and New York both didn't do so well in the wild cards. We'll be back next year, right? Lions and Giants. All right. But for all of you, I'm so proud you're here. And I'm so proud of both my colleagues from Michigan, Gary Peters and Debbie Stabenow, two of the best senators we have in America. And your great members of Congress who are here today as well. We've heard from Sandy, and we have Congresswoman Lawrence and Dingell, Congressman Kildee and Conyers, great fighters as well. And, of course, my dear friend, my brother from Brooklyn, New York, Bernie Sanders, who's very nearby. Now, Bernie and I come from Brooklyn. It's a little like Macomb County. It's a working class place. We went to the same high school, James Madison High School. He went a few years before me. He was on the track team. They won the city championships. I was a basketball player, but our team's motto at Madison, we weren't that good. Our team's motto at Madison on our basketball team, we may be small, but we're slow. So he did better in athletics than I did, but it's so glad that he's here. Now, my friends, I want to tell you a little story, a little recent history about health reform in America, because people forget. And the details have been twisted this way and that way. The facts get out of whack. Here's the truth. Before the Affordable Care Act, our health care system was a mess. Health care costs were growing at a rate even faster than they are today. Workers couldn't afford it. Everything was going up. As we just heard, you had a debilitating illness, it would wipe away all the lifetime of hard-earned savings because the insurance company could just cut you off. Moms and dads, they'd apply for insurance. Their daughter had cancer. We're not putting you on. And they had to watch their child suffer because they couldn't afford that health care. Women were charged more than men for just about everything. And the insurance companies could do anything they wanted, and they did. In the richest country on earth, healthcare was unbelievably poor. And we had a dream. We had a dream. Ted Kennedy, my mentor, wanted to see healthcare for everybody. Sadly, he never lived to see the day, but he's looking down from heaven right now, smiling on all of us as we fight to keep his legacy, affordable health care for all. And so that's why we did it. We did it because people needed much better health care. Average people. I know the wealthy, they can afford anything they want. But average middle-class people, the people of Macomb County, couldn't afford health care. Now they can. We said to the women, we're not going to let the insurance companies charge you more than men. We said to the mama who's had a child with a pre-existing condition, we're going to force the insurance company to give you health care. We said to young people getting out of college, 21, 23, 24, you can stay on your parents' plan while you're looking for that first good job. So, it's worked. We're willing to look at making it better, but we sure as hell ain't gonna repeal it. And we're certainly not going to repeal it when our friends there don't even have a plan to replace it with. It's as if you put 22 billion people in an apartment house. They were fine. They were doing well. Someone comes along and says, we're going to blow up the apartment house and put nothing in its place. That's what they're doing. That is what they are doing. The Republican plan to repeal ACA would make America sick again. It would cause chaos, not affordable care. What do we want? Chaos or care? What do we want? Do you want to go back to chaos? Let me hear you. Do you want to go back to when the days when the insurance companies could do whatever they wanted? When millions of Americans were sick and couldn't afford the care they needed? Do we want to go back to that? Do we want to go back to that? Neither do we in the Senate, and we Democrats are strong, every one of us, to stop them from repealing health care. And we're going to win this fight. And it's not just health care they want to touch. What about Medicaid? They want to slash it. How many of you have parents or grandparents who are in a nursing home? Do you know what will happen when they do what they want to do with Medicaid? They'll be kicked out of the nursing home and force you to pay huge amounts of money to help your parents. They want to privatize Medicare. That means end it. The most successful health care program we have ever seen. They want to get rid of it. My parents are 93 and 88. They depend on Medicare. We are not going to let them cut it, are we? Are we going to let them cut Medicaid? Are we going to let them repeal ACA? And let me say this. Here's Bernie. There's the captain of the Madison High School track team. 1 minute. I'll call everyone up here. All right, come on up. Debbie. Go ahead. All right.
This is the team. The Senate firewall.
You're looking at the Senate firewall. So let me conclude. Our friend, quotation marks, Donald Trump. He said when he campaigned to try and win your votes, he would never cut Medicare, Medicaid, Social Security. And then the minute he gets the nomination, he gets to be president-elect, he appoints cabinet, he nominates cabinet people whose whole life has been to cut Medicare, Medicaid, and Social Security. People like Price, people like Mulvaney. We are here to tell President-elect Trump, we're not going to let you touch Medicare. Are we? We're not going to let you touch Medicaid. Are we? We're not going to let you touch Social Security. And most of all right now, we're not going to let you repeal ACA. It's been a pleasure to be here. I am fighting mad. We're going to win this fight together, the American people and the Democrats in the Congress. Thank you. God bless you. Thanks for coming out today.
Thank you. Just want to get all four of us kind of step back.
What
here.
do we do?
Bernie. No, Bernie's not yet.
What?
Oh, Cecile. No, you're not yet. Cecile.
You're not yet.
Cecile. All right, Cecile.
Okay. All right. It is now my honor to introduce somebody who's probably done more than anyone else to protect women's health care and make sure they get affordable women's health care. Cecile Richards, the president of Planned Parenthood.
Thank you, Senator Schumer. Thanks to all our champions in the United States Senate who are fighting back for us. Because folks' needs for health care, it's not a Democratic issue. It's not a Republican issue. It's a human rights issue, and every single person in this country deserves access to affordable health care. And that's what's so frustrating is last week, I don't know if you watched TV, but in the dead of night when everybody else was asleep, the Republicans voted one more time, one more step to repeal the Affordable Care Act and take away health care from millions of Americans, and we're not going to let them. But not only that, they voted to leave people with pre-existing conditions at the mercy of the insurance companies. Right, and I don't know if you know this too, they also voted to allow them to kick young people off of their parents' health insurance, which we can't have happen. And then when the Democratic senators tried to protect women's health care access, they voted to get rid of that too. Let's be clear. The attacks on the Affordable Care Act are attacks on women's health, plain and simple. Right? Because as Chuck said, this is what happened. Exactly right. I got my friend here telling you. Thanks to the Affordable Care Act, finally, women do not have to pay more for health insurance than men. There's no more gender rating in the United States of America. Right. And like we said earlier, we can't be denied coverage because of a pre-existing condition like breast cancer, right? And for the first time, women's preventive health care is covered for no copay, including birth control. And it's revolutionary, and we like it. 55 million women, including 2 million women here in the state of Michigan now, get their health care for no copay from their doctors. And we want to keep it. In the very first year, women saved $1.4 billion on their birth control pills, and that's money we want to keep. Over and over again, what we've seen in this country is when we invest in women's health, it works. Because of all this, America's women are at a 30-year low for unintended pregnancy, and we are at a historic low for teenage pregnancy in America. We need to keep making that kind of progress. And frankly, I think if there were more people in Congress who could get pregnant, we could quit arguing about birth control and get on with it, right? For the American people, Planned Parenthood is the solution, not the problem. And so when extreme politicians like Speaker Paul Ryan and Vice President-elect Mike Pence, right, make no mistake about it, they're threatening now to defund Planned Parenthood. They're talking about cutting women and young people and men off of life-saving care that we provide, including tens of thousands of people here in Michigan who get their family planning, they get their breast exams, they get their well women visits and their education. Women are worried. In the first couple of days after this election, we had a 900% increase in women calling Planned Parenthood to get an IUD that would last them the entire Trump administration. And that's why next week, millions of women and men are going to descend on Washington, D.C., including me, to say we will not go back. We will not go back. We refuse to let politicians put politics ahead of women's lives. We won't give up. We won't back down. We're going to roll up our sleeves and fight with everything we got. So you ready? Yeah. All right. Well, then it's my privilege to introduce to you one of the fighters we have in the United States House of Representatives, your Congresswoman Brenda Lawrence.
Hello, everyone. I'm here just to warm it up for this amazing slate of elected officials. I want you all to know 618,000 Michiganders would lose insurance if we repeal the ACA Act. Now, what does that include? That includes our Michiganders on Medicare, Medicaid. And where are my millennials today? My millennials, you are under attack because it will take away your right of your parents to give you that quality of life and keep you healthy on their insurance. Millennials, are you ready to stand up and fight? I want to thank you. I want to thank you for being here today. This is amazing because history has taught us that our rights and our freedoms will not be sustained, we will not be able to keep them unless we stand up. Unless we stand up and fight. And today we are fighting, and I'm happy to have you with me because I'm going back to Congress with my colleagues to fight to make sure that America keeps its health care, the America that we love. Stand with us and fight. I want to bring up my colleague, a person that you know fights. She's tireless and she keeps her voice out there. My colleague and the other woman in the U.S. Congress from Michigan, Debbie Stabenow.
Hello, Michigan! I'm here today to reinforce what everybody is saying. Last week, we held a round table and we heard from different people about what affordable care means to them. Bishop Stargill, a bishop, talked about how he had been unable to go to the doctor until the Affordable Care Act passed. And that black men waited too long and ended up in emergency rooms and sometimes dead before they could go to the doctor. I had hospitals and providers there. And Beaumont Hospital told about a worker who had had his hand hurt in a machine in the plant. And the doctor said, "You need surgery." And he said, "I can't afford it. Just put a splint on it." And the doctor said, "I'm there to help you. We need Affordable Care Act so he wouldn't lose the use of his hand." And many of you know, you read it, John got diagnosed with pneumonia 10 days ago. He's doing okay. But but I knew something was wrong and I called the doctor and I got him in. Today at Starbucks, a woman came to me and said, "Thank you for what you are doing. My husband had a cold. We didn't have insurance. I couldn't afford to call the doctor. I was afraid about how much the insurance would cost. And when he was really bad and had 103 fever, I took him to the emergency room. He died because I couldn't afford to go to a doctor." I'm looking at all of you today and saying to the Republicans that want to take this bill away, this isn't about words. It's about lives and real people's lives and their health. I believe that if you live in America, you have a right to affordable, quality health care. And I want to introduce you now to two people. Karen's a little shy and can't talk, but she's someone I want my Republican colleagues to look in the eye of. Dave Hartman and Carol Lowinger. And if she hadn't had insurance, they wouldn't be here to tell their story. Welcome, Dave and Karen.
I don't quite have the same fire, so apologize. If it wasn't for a group of extremely talented surgeons at the University of Miami Hospital and the ACA, my girlfriend Karen would not be here today. She worked as a bartender most of her adult life, sending her daughter to Michigan State University as a single working mother without health care insurance. In 2015, she went online and signed up under the marketplace. She got her coverage card on February 28th, and the next day we left for a trip to Mexico. As we were packing, she asked if she should bring her insurance card. I told her, "You should bring that everywhere you go from now on." On March 7th, she had an accident on a moped that shattered her knee and severed the artery behind it. The emergency clinic on the island didn't have the capacity to help her, so we needed to be medevaced to Miami. The doctors there weren't able to save her leg, but managed to save her life. She needed to stay in the hospital for another month of care and rehabilitation. Afterwards, there was more physical therapy, as well as 2 prosthetics, a training one, and a semi-permanent one. Between the over $160,000 for the medevac, over $75,000 of equipment, physical therapy, hospital stay, the coverage that she was able to get through the ACA has covered to this date almost $500,000 in expenses. As if the initial trauma of losing her leg and near her life wasn't enough, imagine how much more difficult life would be looking at those bills piling up. Without the ACA, my girlfriend wouldn't be in the place she is now, alive, healthy, and not in crippling debt. Thank you very much, everyone that came out here. Next, please welcome Congressman Dan Kildee.
This is what this fight is all about. Healthcare is not about red or blue, Republican or Democrat. It sure shouldn't be about rich or poor. The right to health care often, for so many Americans, is literally about life or death. We live in an amazing country, a productive country, a creative country. We live in the wealthiest nation on earth at the wealthiest moment in its history. We can afford to provide health care for everyone. We can't afford to be a society that does not. I come from Flint, Michigan. We know something about what happens when governments put profits and the bottom line ahead of the health of its citizens. We had a city of 100,000 people poisoned by their own state government. It's that same philosophy that has these Republicans in Congress deciding that without a plan, without a guarantee, without any security, that we know if we get sick, we don't lose everything we've worked for, they're willing to throw away the first ever opportunity to provide health care for every American. It is wrong, it is immoral, and the people standing right in front of you are the ones who are going to stop them. We have to fight, and we have to win. Let me now bring up one of the fighters that has been working on this for a long, long time, the Dean of the House of Representatives, the ranking member and the next chairman of the House Judiciary Committee, our friend, Congressman John Conyers.
Boy, look at this crowd. Holy smoke. I want you to hear what the most impressive person I've ever had the honor of working with in the struggle for justice, Dr. Martin Luther King, Jr. Here's what he said. This is a direct quote. Of all the forms of inequality and injustice in health care, this is the most shocking and inhumane. Of all the forms of inequality, injustice in health care is the most shocking and inhumane. That's Dr. Martin Luther King Jr., and that's why I'm here with you, and that's why I'm so proud that all of you are here. We want not just to save the ACA, we want universal health care for everybody. Everybody. Single payer. Single payer. Everybody in, nobody out. And I've introduced that bill for years, and I'm keeping on it. We get a few more every year, but we're not going to give up anything. And to this president-elect, he's got a fight on his hands. I'm warning you, because we're not moving back, we're moving forward. And that's why we're all here with you today. God bless you all. Thank you very much. Senator Gary Peters. He was a congressman. He worked in the reserves for many years in the Navy Reserves. He's a great leader, and you heard him today, but wait till you hear him now. Welcome, Gary Peters, United States Senator.
Thank you, John. Love you. Love you too. Well, thank you, John. It's good to be back. The crowd keeps growing and growing. We have had incredible speakers. There's incredible energy here. But as you take this energy from today, remember it does not stop today. You need to get out and you need to call your friends. You need to talk to your coworkers. You need to get on social media. We need to generate a movement that lets the Republicans know there will be a price to pay if they repeal the ACA. And are you the ones that are going to make them pay that price? We are going to be loud. We are going to be strong. And we are going to stop this. But we need to do it together. We have to make sure that folks know we can't go back to the old days before the ACA, when we know that healthcare costs were going up 17 times faster in Michigan than wages. It was unacceptable. People couldn't afford it. Folks were losing their insurance. You had folks who the only way they could get health care was when they showed up in an emergency room because it had gotten so bad. Ladies and gentlemen, an emergency room is not health care. That's emergency care. What we need in this country is health care. And know that folks can have that treatment. As you know, if you go to the emergency room, if you have cancer, you can't go to the emergency room. You need to be in with a physician. You need specialists. You may need hospitalization. You need a full complement of health care. And that is what the ACA does. And that is why we are fighting for it. We are fighting for nearly 800,000 people in our state alone. 800,000 people. We will make sure they continue to have health care and their families will have health care because we are united today and we will be united tomorrow. And I want to introduce the next speaker, someone who I've had the privilege of working with and a champion for health care. In fact, I just want to have one more story. There's so many stories. A gentleman from Traverse City who talked to us, who was in tears talking about how important the ACA is to his family and the fact that it's saved his son's life. A son who has been dealing with mental health issues and could not find the kind of help because they simply couldn't afford it. In fact, he got a little bit of treatment in the emergency room, but he said with tears in his eyes, "Why is it that I had to wait for my son to attempt to commit suicide before he could get health care? That is outrageous, and it is outrageous in this great country." And that's why this next speaker has been a champion for mental health care. She has fought for children's care, for women's care. She is my mentor in the United States Senate and an incredible champion for people in the state of Michigan, Senator Debbie Stabenow.
Thank you, Senator Peters. Are you ready to rock and roll here? This is the beginning. This is standing up. This is day one in a long process. And I want to thank our great leader, Chuck Schumer, for joining us today. Our great leader, Bernie Sanders, my friend, Gary Peters, the delegation, and the family sharing their stories. You know, the fact of the matter is that Republicans get sick. Democrats get sick. Independents get sick. People who don't vote get sick. This is not a political issue. I can't think of a more personal issue for each and every one of us. And the only way that we stop this is with your voices and your energy. The fact is, very shortly, they've got the U.S. House, they got the U.S. Senate, they're going to have the presidency. If they want to rip health care apart, rip Medicare and Medicaid apart, they can do that. But we as citizens have a voice. They don't own our democracy. We together own our democracy, which is why we are here. That's why we are here and asking you, and you're here in the cold, and God bless you, and we're so happy that we're Michigan tough. I told Senator Sanders, we're Michigan tough, Senator Sanders. But the truth is that we have power if we use our voices. And so that's why we are here. We're going to do everything humanly possible to stop this and do everything we can on the nominees. You know, when the president-elect says one thing and then nominates Tom Price, who's the guy who wants to rip apart Medicare and Medicaid and the Affordable Care Act, we're not going to believe him. We're just not going to believe him. So the truth of the matter is that if you count all pieces of health reform, we have about 2 million people in Michigan that will lose their health care. 1 out of 5 people standing here, 1 out of 5 will lose their health care. Insurance companies being put back totally in charge Remember when if you paid your premium and got sick, they could decide they were going to drop you? Can't do that now. A whole range of things. But if we aren't loud, if we don't do what others have said, if we aren't emailing and phone calling and going to offices and speaking out and telling our stories, they're going to proceed. So we are grateful you are here. I'm grateful for the Michigan Democratic Party and Brandon Dillon for organizing us today. Let's say thank you. And I want you to know that in my heart, healthcare policy and healthcare brought me into public service, including healthcare above the neck, as well as healthcare below the neck, mental health care. And I'm getting up every morning and suiting up on your behalf to fight. And my colleagues are with me. We're in this together. And I want to introduce, before introducing our great guest that's joined us from Vermont, I want to first bring up one more family to tell a story. Because Mary Sandifer wrote me a letter from Dundee, Michigan. She allowed me the privilege of reading it on the Senate floor during the debate last week. And I wanted her to share her story with she and her family, small business owners, their 3 children, and what the Affordable Care Act has meant to them. Please bring Mary. Come on up, Mary. Thank you for being here. If you want, we can put this back up here. All right. Thank you.
Thank you for giving me this opportunity to share my experience with the Affordable Care Act. My family and I have been enrolled in the ACA since 2015, and this has allowed us, as Senator Stabenow mentioned, to become small business owners in Dundee, Michigan. Prior to the ACA, I was working to provide insurance, but after losing my full-time job, my part-time wages barely covered my portion of my employer-provided health care. I began looking into the options the ACA could provide for me and my family. After applying, we were told the income that we had would qualify our children for My Child, or the CHIP program that we have here that fell under, that's right, it fell under the Medicaid expansion of the ACA. I was relieved to find out that we could join My Child because we had no idea if this new business adventure would succeed or not. I am proud to say that our business has grown, and we can now afford a Blue Care Network family plan. While making this transition, I was so grateful that we didn't have to worry about regarding pre-existing conditions. You see, our oldest daughter, who is now 20 and a junior at the University of Michigan Dearborn, go Blue, has life-threatening allergies and asthma. As Congress proceeds to dismantle the ACA, I am primarily concerned with all of our patient protections through the Patient's Bill of Rights. Will my daughter have coverage under the new insurance until she is 16? And if not, what kind of insurance will she be able to have knowing that she has pre-existing conditions? And why are we putting all these obstacles in front of our young adults? Sure, the ACA has like many things, the ACA has faults. But to scrap it and say that we cannot use it as a seed to grow and improve upon is beyond my understanding. And to suggest that there's nothing to keep is absurd. Finally, I would like to thank all of the Democrats in Congress, especially the Senate Democrats, who stood out of order with us and voted no early Thursday morning. Please continue to stand with us, remain diligent, and together we can save lives when we save our health care. Thank you.
Thank you, Mary, and your whole family. And she's right. You know, we want to work together for more affordable health care. We can think of great ideas. How about a public option? Not single payer. We got things we can do. But they just want to rip it away and create chaos for every family, and that is wrong. So I want to introduce a gentleman right now from his time as mayor of Burlington, Vermont, to a fighting member of the U.S. House of Representatives, to his election in the United States Senate in 2006. Senator Sanders has spent his entire career fighting for working people and middle-class families. He's inspired millions across America with our shared belief of equal opportunity for every American. And when we decided to do this rally, I was so pleased that he accepted my invitation to join us in Macomb County today. Give a warm Michigan welcome to Senator Bernie Sanders.
Thank you. Let me thank Senators Stabenow and Senator Peters, and let me thank the Michigan Congressional Delegation and the Michigan Democratic Party for putting on this fantastic event. You look great from up here. And I want to tell you, we came up with the idea of doing rallies just a few weeks ago. And we said, well, you know, we don't have much time. It's the middle of winter. Maybe we'll be able to do 5 rallies, 10 rallies. That'll be good. Turns out today, from Maine to California, there are 70 rallies. And tens of thousands of Americans are saying loudly and clearly, Republicans, you are not going to destroy the Affordable Care Act. It's been said before, and let me say it again, especially on this weekend where we celebrate one of the great Americans in the history of our country, Dr. Martin Luther King Jr. This is the wealthiest country in the history of the world. It is time we got our national priorities right. The United States today, and I hope everybody in America understands it, we are the only major country on earth not to guarantee health care to all people as a right. So our job today is to defend the Affordable Care Act. Our job tomorrow is to create a Medicare for all single-payer system. And let me be very clear. There are differences of opinion about the Affordable Care Act. Some people like it, some people don't like it. But very few Americans believe that we should repeal the Affordable Care Act without a replacement program to make it better. No, we are saying to our Republican colleagues, we will not allow you to throw up to 30 million Americans off of health insurance. And I want you all to think, because we've heard some stories today, some poignant stories of people who talked about what the ACA did to them. They are talking for millions of Americans. Think for a moment. You take away health insurance from 30 million people, how many of them will die? And the answer is many thousands. How many of them will become much sicker than they otherwise would? Millions would. So our job today is to tell the Republicans, no, you're not going to throw 20 million people off of Medicaid. You are not going to privatize Medicare. You are not going to defund Planned Parenthood. You're not going to raise the cost of prescription drugs for seniors. And by the way, as part of the repeal of the Affordable Care Act, they want to give over $300 billion in tax breaks to the top 2%. So on behalf of the children of this country, on behalf of the working people of this country, on behalf of middle-class families who pay for their parents in nursing homes through Medicaid, what we are saying to the Republicans, if you want to improve the Affordable Care Act, let's work together. But if you think you're simply going to throw millions off of health insurance, you got another guess coming. Martin Luther King Jr. said this, and many great Americans have said it, and you all know this. Real change never takes place from the top on down. Real change always takes place, whether it is the civil rights movement, the women's movement, the gay movement, the environmental movement. It always takes place from the bottom on up. So I say to my Republican colleagues, yeah, you're going to have to worry about Senator Stabenow and Peters and all of us in the Senate and our friends in the House. But that's the least of your worry. You're going to have to worry about millions of people who are standing up, who are fighting back, and who demand the day when health care will be a right of all people, not just a privilege. So thank you all for being out here today. This is just a wonderful turnout. Thank you all. This is the beginning of the fight, not the end of the fight. And let me now bring up two real fighters from the trade union movement, Cindy Estrada and Leslie Frayne.
Wow, you guys look great out there. You know, I've been a supporter of Bernie Sanders for a long time because even before he was running, he always stood up for working men and women. And one of the things that just resonated with me and what I want to teach my kids is Bernie always said it wasn't just about the leaders. It wasn't just about us that are elected, but it really was about the people. And our union, the UAW, the United Auto Workers, was built on the people that built this state. And so when I think about looking at everyone and coming from an organizing background, I get excited. But I only get excited because it's the work that we're going to do. Everyone's going to leave here very energized, feeling really good. But it really is about what we do when we get home tonight. It's about the people that we call. and that we talk to about this. It's about the calls that we make to Congress and then hold the hand of those 20 people we talk to, hand them a cell phone, and make sure they make that call. Because Bernie's right. This is about sending the Republicans and everybody who says, let's gut health care without a replacement, that we, the people, are not going to allow it to happen. So that when they go to Congress, we're out in the streets fighting for every man and woman. And I know in the UAW, we have health care, and every day it is a fight to keep it. But I know that the great UAW members standing over there are going to fight for every person who doesn't have it, because health care is a right for all. And so, when we're done pushing back on this repeal of the ACA, then we got a bigger job, because we're going to get single payer and make sure that everyone. So I look forward to working with all of you and watching the great work that we do and the plans that you come up tonight when you go home and the work that you do tomorrow. Thank you.
Good afternoon. I'm proud to be here on behalf of the 2 million working men and women of the Service Employees Union to speak out against the extremist plan to repeal and erase our health care. You know, there are lots of different interpretations of the November election, but one thing is crystal clear. No one in this election voted to rip away health care from 30 million Americans. No one in this election voted to destroy 3 million jobs. And no one voted to increase the healthcare premiums and prescription drug costs that each and every one of us pays. I want to thank Senator Schumer, Senator Sanders, Senator Stabenow, Peters, and all of the other elected leaders here today who are standing firm in their defense of Medicaid, Medicare, and the Affordable Care Act. And I want to thank all of you for coming here today to defend the health care that you and your families depend on. But it's not just here, and it's not just today. Just last week, 18,000 people flooded the Senate switchboard calling their electeds to demand that we defend the Affordable Care Act and to reject this crazy idea of repeal. Today and every day, SEIU members and so many, many others are participating in rallies, in protests, in town halls, in press conferences from Cleveland to Tampa, from Portland, Maine to Los Angeles. Together, we can make clear that what Americans need and Americans want is a healthcare system that delivers affordable, comprehensive care for everyone. We want care, not chaos. And if the Republican leaders in Congress think they have a proposal on how to do that, it's long past time for them to show us their plan. And it's not just healthcare that's at risk. Healthcare repeal destroys jobs. Michigan alone can lose more than 100,000 jobs, and that is not acceptable. Corporations will be off the hook for providing employees with health insurance, and that is not acceptable. Millions of Americans who work hard to make our country run in nursing homes, in grocery stores, in child care centers will lose a fair shot at a healthier life if Medicare expansion is wiped out in 32 states, and that is not acceptable. People like Detroit home care worker Elaine Pope, a cancer survivor who is here today, who never had health insurance before the Affordable Care Act. After 24 years of providing quality care for frail elders and people with disabilities, Elaine would once again be uninsured and faced with unfathomable health care costs. We are here today because we will not allow that to happen. Not on our watch. For Elaine Pope, for the millions of Elaines all across the country, for our families and for our communities, we will keep fighting and bringing the voices of working people to the very doors of Capitol Hill. We will demand and defend the human right to health care justice, to quality, affordable health care for all.
As we officially bring the rally to a close, this is not the end, right? This is the beginning. Follow the Michigan Democratic Party Facebook page for additional actions going on. Do your own actions in your own community. Stay engaged with us to save our health care. Thank you so much. Save our health care. 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 Save our health care.
Save our health care.
Save our health care.
Save our health care. Save our health care. Save our health care. Save our health care. Well done.
Is the preacher, and it seems nobody's interested in learning but the teacher. Segregation, determination, demonstration, integration, aggravation, humiliation, obligation to our nation.